Hello and welcome to a new class, Epidemiology and Biostatistics. You're all in the right place, I hope. I think so. Fantastic. Okay, so a couple of things about this class. This is a hybrid class. Am I able to up mic? A little less. You guys still hear me all right? All right. So this class is a hybrid in terms of it being roughly a third of it is going to be just straight lecture time with me in front of you. A third of it's going to be journal clubs, which I think will be a little more interesting in terms of practical application of your skills here. And then the other third is going to be online lectures. Okay, so that way it gives you a little bit of time. You can go kind of do it at your own pace, all of that. So a couple of things. One, you got the sticky board here on Canvas. You can be posting questions during the live discussions. You're going to have the syllabus there, which you'll see is pretty straightforward in terms of the grading. A large chunk of this is going to be related to just the lit review exercises. Those are the journal clubs we're going to do in class. So about 40% of your grade is just participation, right? So does anyone have some apprehension about statistics and numbers and stuff? At least one person, two people. Okay, everyone else is like a math whiz, correct? Okay, well, I didn't think so. Don't worry, you don't have to be math whizzes to pass this class. It'll be totally fine. But a large percentage of it is going to be the journal clubs and participation. So as long as you do that, you already got at least a 40 in the class. It's like halfway to passing. Easy, right? Anywho, then we'll have two exams that are going to be the other 60% of the grade there, right? So we don't have that same stipulation. As long as you get a passing average in the class overall, you're fine. You don't have to worry about that. So there's that. In terms of textbooks, there's nothing required. Some people really do like the ridiculously simple series for biostatistics. Some people have some luck with that. I don't personally have a preference for one book over another. It's just something you may want to consider. And then here's the schedule here, and this may change as time goes on. Of course, we have an impending hurricane, right? So that could totally throw everything for a loop, but this is the intended schedule here. So these are the lectures that'll get posted. Here's when the online portions are there in green. The other times you'll see the journal clubs and whatnot. You'll be assigned into random groups for the journal clubs, and we'll actually do that in class. We'll kind of work together, come up with an idea, do some interpretation of the literature, come back, and then report out on that. So that'll be kind of your group work from that standpoint. You do have a pop quiz today. I want you to do this during class. You guys ready? This is easy. This is the easiest pop quiz you're ever going to take. Basically, I want you to go ahead and during class today, during this time period, this is actually open until 4:30 since that's when time was going to be when the class time was originally going to end. I'd like you to take this. Basically, I want to get an idea for what type of topics you guys are interested in, so I can pick articles that are relevant to your interest, right? So if everyone really likes infectious disease, I can pick articles focusing on that topic. If everyone really likes pediatrics, so go through, pick any kind of as many topics as you like. If you don't like a topic, don't pick it, and then I'll be able to get an idea, kind of a random straw poll to determine what you guys find most interesting. So just please do that at some point here. It takes you just a couple seconds and turn that in. That just counts towards your participation grade. So please do that, and we'll be able to pick some interesting articles for you. Anywho, so any questions on the class so far? Okay, so those are big things to do right now. And then the first two sections are already posted here. So let's get started with the actual lecture itself. So introduction to statistics. Why do you think we do this class? Anyone know why? It's torture, possibly. It's a possibility. Well, because you being clinicians, like medicine, is it just one static thing? You read a textbook and you know everything about medicine that's ever going to be? No, medicine's constantly changing. You need to be able to go back to the literature to find, okay, what are the new advances? What are good pieces of information? What are bad pieces of information? Because you've heard of evidence-based medicine, right? This is how we start that process. How do we actually evaluate literature to determine, do we have good information or not? Because a patient's going to come up and they're going to have some random news article that they saw. They're going to have some random paper they're going to bring up to you and say, I hear that chocolate's supposed to cure my cancer. Right? You hear stuff like that all the time, right? Random things, and you're like, well, that obviously can't be true. But you need to figure out why that's not true, right? You need to be able to dig back into the literature and to be able to determine that. So if you've ever been, reading an article and you see p-values or you see this is statistically significant, we're going to try to learn what those mean and how to interpret that. So some of you have probably had a statistics class before, correct? Yep. Does anyone feel like they're like a whiz at it? Okay, I was really counting on somebody to be good at that because I'm pretty bad I'm just kidding. No, we're going to get you to like kind of what you need to know in order to be able to go through that literature there. The main purpose for this is to get you ready for your grad projects as well, because your grad project 1, which you're going to do in the summer, is actually going to be a big 10-page literature review. Actually, you're going to go through, you're going to pick your own topic, go through the literature of recent articles, and be able to kind of summarize, okay, well, I have this clinical problem, here's what I think is the best way to manage it, or here's what I think about X, Y, and Z, right? So kind of where we're going to be going to with this class here. And again, with this lecture here, I just want to kind of delineate some of the reasons why statistics and probability are kind of difficult topics, why they're not super intuitive for a lot of people, and then cover some of the obstacles to why people have a hard time learning this stuff. We'll kind of try to address those as we can, and then understand some of the kind of the basic terms that we're going to need when going forward with the rest of the lectures here. And again, statistics, 60% of the time, it works every time, right? There's a lot of ways you can misconstrue statistics. You can basically say anything you want with numbers, correct? And in fact, that happens quite a bit in the media. It happens a lot. Even in the medical literature, you think you get an article coming from a journal, you automatically assume that's correct information, right? Not always, right? It could be misinterpretations of the numbers in some cases here. And so that's why you need to have a very critical eye when you're looking at this stuff. I'd like to give you one crystal clear example of how I was able to use statistics to better my own life, and possibly you may be able to do the same in your life. Back when I was graduating fellowship, my wife, who was also doing her second-year residency at the time, we lived separately, and we needed to move down to Orlando for jobs, right? And so I said, oh, well, this is a good opportunity. We can move in together, right? She said, oh no, we're not going to do that. You got to live separate. And I said, why do we got to live separate? We got two rents, like we can save money. And she's like, no. If you move in together before you get married, your rates for a divorce are higher. And I say, where'd you get that from? And she says, Cosmo. I was like, I don't know if I believe the statistical rigor of Cosmo. I don't know if I trust the validity of their stats there. So I said, well, there's got to be some actual information on this. And so I did some digging. And sure enough, I found the CDC has a whole article just about this. I was like, wow, they actually have information about cohabitation and what happens in terms of divorce rates. Some of you may find this very interesting information, may be able to use it in your life one day. What was interesting, though, what they found was that it is true. If you are not engaged and you cohabitate before marriage, your divorce rates were higher. I think it was 5 or 10 years. At 10th anniversary, right? So your divorce rates are higher than people who had been married before they cohabitated. I said, oh, shoot. She's right. My argument's cooked. But I said, wait a second. No, those that were engaged before they cohabitated had similar divorce rates as those who were married before they cohabitated. I said, I got it. This will be a cheap solution. So I proposed to her. We got engaged. She moved in with me. Everything worked out great. So now actually Saturday, I don't know if the hurricane's like a bad portent of that. Saturday is actually our 6th year wedding anniversary. And so we'll see what our divorce rates are at 10 years. But so far, so good, right? So again, this is how I can use statistics to actually better my life, right? So anyway, that's actually a true story. So anyway, but people are bad at statistics generally, right? Because we like to jump to conclusion, right? We as people are designed to look for patterns, just like our ancient ancestors would look for the cycles of the moon. They would look for the cycles of seasons to plant things and to move from herd to herd. We look for patterns, and it's a good survival instinct here. But that can be really tough because people will jump to conclusions too quickly and will oftentimes take anecdotal information and say, well, this must be the gospel truth, when that may not be the true case here. So it's really important that we look for really good statistical rigor when we're trying to make conclusions using limited data that's available to us. Right? So let's say, for instance, you're looking at the idea of hot hands, right? So I'm not that big of a sportsman myself, bit of a nerd. I prefer the video games instead. However, there's this idea that with basketball that if you start to get a string of shots, that you will continue to get those shots in, right? So you'll be able to have this idea of hot hands, essentially. I believe they call those field goals, perhaps. I'm just kidding. I know there's no basic terminology. Anywho, point being is they were actually looking at some data here. They're looking at the 76ers during this 1980 to 81 period, and they were looking at the actual misses and shots that were being made by these players here. And they were saying, well, there must be some sort of pattern to it. There must be something to this. And you'll kind of to look to see this pattern here. Do you think it looks random or not? And so looking at this, what would you think? Does it look completely random? Does it look Like maybe there's something to it where if you get one shot, you're more likely to make more shots. If you were to miss a shot, maybe you're more likely to miss shots. What do you think? Probably looks like there's actually a pattern there, right? It looks like, okay, well, look, there's a lot of strings of 5s, 4 and 5s, you know. So we as people would say, oh, yeah, maybe there's something to that. However, if you apply the actual statistical rigor to it, you find that it's actually just completely random. It's roughly a 50-50 shot whether or not they're actually going to make it in those cases there, just like flipping a coin, right? So the point is that we will look at anecdotal information and be able to draw conclusions from that. Frequently, that's not correct, right? This is why we have to go back to the literature, back to looking at larger sample sizes to determine, okay, what's actually going on here. So again, it's really hard not to see patterns. That's why our brains are just evolutionarily, designed to look for those patterns there. But again, by using statistical rigor, it can help us to prevent from doing that. So again, what's the best way to know, say for instance, if a drug works for a given disease? Like how would you design a study to look for that? I could take a bunch of people, say I could take 63 PA students, and I could divide you in half. Give one person the drug, or give one half the drug and the other half not the drug, right? And then I see what happens, right? That's a good way to do it. However, you may not be able to do that in all cases, right? Sometimes I can't have good evidence for, say, for instance, my research project when I was in fellowship was about coral snake bites. And we wanted to find out, is the limited availability of coral snake antivenom, could we wait to treat patients before they became symptomatic, or should we just treat all patients with a bite? However, do you think it's ethical to bite a bunch of people with coral snakes and then give some of them antivenom and then some of them not? No, oftentimes ethical limitations actually prevent you from doing a lot of these types of studies. So again, we have limited information in most cases, but we have to draw some kind of conclusions to treat our individual patients, right? So anyway, we realize again that coincidences are very, very common, right? So again, when you think about things that are likely to occur or not likely to occur, imagine this hurricane come barreling towards us. You imagine there's probably some lightning associated with that hurricane, right? So what are the chances you think you have of actually being struck by lightning? Pretty good or pretty low? Some of you might be, it depends on where you're standing, right? Some of you might be more gung-ho and standing outside in the eye of the hurricane saying, bring it on. Most of you might be inside. So I think overall, the chances of one of the 63 of you actually being struck by lightning is probably pretty low, right? It'd be very rare that would happen. However, we know lightning strikes all the time, right? We know it still hits somewhere. It's just where it hits is going to be, it's one of those things where things that have a very low probability happen all the time. It's just it tends to be pretty random there, right? So again, even though it seems like a remarkable coincidence, it actually, hindsight's always 20/20 as it turns out. So I'd like to give you an instance of this, right? So thinking about this is called the birthday paradox, right? So what do you think the chances are someone in this room shares the same birthday as you? Pretty high or pretty low? The same exact birthday as you. Pretty small, right? Because any random person you look at, okay, there's 365 days in the year. The chances they have the same birthday as you is what? 1 in 365, right? So the chance of you finding one person in this room that has the same birthday as you, the question is, well, how likely is that to occur? You as an individual, probably not very likely. However, what are the chances that at least 2 people in this room share the same birthday? It's a lot higher. When you actually do the math, you end up finding out that just based off 64 people in this room right now, assuming everyone came back from lunch, looks like it, there's a 99.71% chance that 2 people in this room share the same birthday. There's 3 already? Who's the 3? Okay, what's their birthday? August 2nd. There you go. See, you already proved the paradox right away. 3 people actually share the same birthday. I guarantee if you went through, and you probably find a few more 3 April Fool's days. There you go. So see? So again, the chances that you have the same birthday as someone else, very low, but the chances of a group having the same birthday, very high, right? So again, that's called the birthday paradox. You guys kind of ruined it because normally I had to go like person to person and say, look, you 2 are birthday siblings and you don't even know it. But that's all right. You guys get the point anyway, correct? Anywho, let's think about some other situations here where people are trying to apply probability and see if they make intelligent decisions or not. So let's say, for instance, we have 2 bowls of jelly beans, right? We have one small and one large one. In the first bowl, we have 9 white jelly beans and 1 red. And in the other bowl, there's 93 white jelly beans and 7 red. And you get a prize if you pick one of the red ones. So which bowl would you pick out of? All right, who would do the first one? 9 versus 1. Okay, who would do the second one? No one's brave enough to say so? Well, some people, you guys are very smart, obviously, right? Because you're in PA school and you came to Orlando specifically, so you must be very smart. But a lot of people illogically make the wrong choice. They say, well, I'd rather have a chances of pulling one of those 7 of them versus just pulling 1. However, you realize logically that what's the chances of pulling a red one in that first bowl? It's 1 in 10 versus in the second bowl it's what? 7 out of 100, right? Or 7% versus 10%. So in these cases there, that would be the illogical choice would be to pick the second one. But again, most people are not very smart, and they tend to pick the wrong choice, or at least not logical, as the case may be. Anyway, so again, another example here would be if you were looking at the risk of death being caused by something. You know, when you think about the rate of cancer, if it's riskier, which one do you think is riskier, having cancer that kills 1,286 people out of 10,000 or one that kills 24.14 out of 100? The second one, right? Why? Right. The rate's actually double, right? 24.14 versus out of 100 versus 1,200 out of 10,000. But again, a lot of people think 1,200, that's a big number. That must be much more deadly of a cancer. But again, you're going to be able to intuitively look at this stuff and more logically evaluate it and say, okay, well, let's actually compare apples to apples here and be able to compare similar numbers to one another. So again, that's a big thing we're trying to avoid, is try to illogically look at these situations and be able to make real concrete conclusions about things. And again, how about one where we have, say, jelly beans in 2 different urns? This one's maybe a little bit more abstract. Each one has 100 beans in each one. And the first one we know has a 50-50 mix of red and black. The second one has an unknown mix of red and black, and you win a prize for picking a red one. So which urn do you choose at this point? So who chooses the 50-50 one? Okay. Who chooses the second one? You choose the second one? How come?
Just because I don't know what's in it, so it might have more red, but it might not.
It could have 99 red and 1 black, right? We have no idea. So in those cases there, it might as well be 50-50 because you're either going to pull a red one or a black one. So again, when you don't know the probability, you actually find that what's interesting, if you do like MRIs on these patients here, you tend to find that when they have that uncertainty, when they have that fear, they actually start to light up the amygdala, right? And what does the amygdala do for us? It's our fear center in our brain, right? So again, that unpredictability, that uncertainty tends to trigger a lot of apprehension in people, and so they have a hard time picking that second urn. Just like a lot of you said, oh, we do the 50-50. At least I know those odds. At least I know it's only one or the other, right? So anyway, so again, just a little options or just examples to show you how people think about these things intuitively. Okay, also things like Bayesian calculations. You ever heard of Bayesian statistics? What that means? Basically, you look at a population and you have an idea of what the prevalence of a disease is in that population beforehand, and then you start to test a group of people out of that population to see if they have a disease or not, right? So you're running screening tests, and you guys will do this all the time in your clinical practice, right? You run diagnostic tests to see, does a patient have this disease or do they not? And by knowing the prior prevalence in that group beforehand, it will give you an idea of how likely a test was to be a true positive, false positive, a true negative, or false negative in these cases here, right? So let's say, for instance, we're doing HIV blood screenings, right? So we're just testing a random sample, but we're doing it in just the general population. Now, the rate of HIV in the general population, would you say is pretty high or pretty low? Probably pretty low, right? So let's say there's like a 0.1% prevalence in that group there. I mean, we'll define things like incidence and prevalence a little bit later on, but let's just say 0.1% of that population has the disease in question. And then we do an antibody titer test, and it's pretty good, but it has 99% sensitivity, right? So not quite 100%, but still pretty good there. What do you think the chances of having a true positive versus a false positive test in that group? And so you can actually do the math. And again, I'm not going to have you go through and do the math step by step, but I want you to be able to do the interpretations here. So looking through that, let's say we took 100,000 healthy people that are tested. We want to see whether or not they have HIV, right? And again, you're going to find that in that population, we said 0.1% should have the disease. So out of that 100,000, 100 of them will have the disease, correct? Straightforward so far. We said that test is going to be positive in 99 of them, right? So 99% sensitivity there. And then we find that the other 99,900 do not have the disease. However, because that test was only 99% specific, we tend to find that you actually have a false positive rate of 1%. So what's 1% of 100,000? Well, basically, you end up getting 999 false positives, plus the 99 that you missed in another group as well. So you end up getting 1,098 positive results. And again, how many people do we say actually have the disease out of that group? Only 99. So is that a very good test? You have 1,000 people roughly that you misdiagnosed with that disease. Is that a good thing or a bad thing? probably a bad thing, right? Because you have to do follow-up testing, and then you have to do further laboratory testing to figure out if they actually have it or not. And then you find, okay, actually that was a false positive. You can induce a lot of anxiety in those patients there. So again, this is the things we're having to look at to see, okay, well, this test result came back positive or negative. What does that actually mean for my patient? And a lot of times the population really does factor into that, right? So again, here you only have a 9% true positive rate. The other 91% are false positives. Doesn't sound like a very good test. However, what if I were to do the same thing, but let's say I were to put it with another population, right? So who do you think would be like a high population at risk for having something like a communicable disease like HIV? IV drug abusers, right? So some of you might have looked ahead in the slides. So let's say we have 100,000 IV drug abusers, where we know that the prevalence is going to be higher in that group. Let's say 10% in that group will have HIV. Okay, you do the same numbers, and essentially what you're going to find is here you would have 10,800 positive results, but now you have 92% true positives. Is that a lot better than the previous group? It was only 9% before, now it's 92% true positives. It's a lot better, right? And again, these things are not intuitive, and we'll learn how we apply these in actual clinical practice later on. But again, you got to know your population. You got to know things like what the prevalence of disease was in that group beforehand, before you can make a lot of these intuitive sort of assumptions here. Okay. So again, we don't do these things intuitively. That's the main point we're trying to draw here. And again, if none of this is making sense yet, don't worry. We're going to get into the weeds on this stuff. We're going to learn exactly what you need to know. So again, this is important because your interpretation, when you go back to that patient and say you have the disease or you don't have the disease, is going to have a big impact on that patient, right? Whether you're right or wrong, as it turns out. So anyway, so again, we're also fooled by multiple comparisons. When I say multiple comparisons, what do you think that means? So has any of you done any research in a lab, like maybe in your undergrad, right? Okay, did you ever have that thing where like your results came back? I did a summer internship one time where I had this big experiment I had to set up and run it, and it came back completely negative. And then I told the guy who's overseeing me, the primary investigator, and he's like, "Well, just keep trying other things until something shows positive." You guys ever experienced that? Exactly. Is that good science? Right? We know things show positive by random chance alone, and in fact, when here's an example here where they were actually doing some statistics here. They were looking at health statistics for 10 million people in Canada. Basically, they're mining the data. And saying mining, what does that mean? They're just kind of just getting as much data as they can possible, right? They're just kind of look for something. They're on a hunt, essentially. And they examined 223 different reasons for hospital admissions. Okay, so they had that data available to them. And they were looking to see whether the reason for the admission had anything to do with their astrological sign. So you as logical people would say, is there any link between astrological sign and reason for hospital admission? Probably say no. So we may say yes. I have no judgment against you, but probably unlikely to actually be true there. So what was interesting, what they found 72 statistically significant results, meaning that maybe if you're a Pisces, you're more likely to be admitted for drowning. That'd be ironic, right? Or maybe if you're giving birth to twins, you came back Gemini or something like that, right? Is that the one with twins? Yes, okay. I know my astrological signs better than I know my state abbreviations, but regardless, even though they found all these statistically significant links, that doesn't mean that there's actually something there, right? If you were to actually look at it, if you were to actually find, just by random chance, just assuming a 5% false positive rate here, you would assume that you'd find 134 significant associations just by chance alone, but they actually only even found 72. They found even less than that, which you would expect just by random chance. So again, these are one of those things where you can look for data for days and days and days, and you can keep comparing things. Eventually you're going to find something, but that doesn't mean you actually have anything. And again, you don't want to be reporting on these false positives when they're not really true. We're going to talk about different types of errors and type 1 and type 2 errors and how we can avoid some of those. So again, multiple comparisons can be a problem. Again, something like that may be public. I mean, I'm sure you've seen articles like that on Facebook or something that pop up. Like, look, if you're a Gemini, you're more likely to show at the hospital with this, right? Like, that's quote unquote fake news, right? So these are things you have to be really careful with. And again, look at other things like, trying to ignore, say, alternative explanations for study results. Let's say, for instance, there's a study on acupuncture and osteoarthritis, right? And they were looking to rate their pain before and after treatment. And then what they found was the pain decreases in most patients, okay? They found a statistically significant result there. And the question is, well, the acupuncture must have worked, right? Could it be something else, though? So again, this is where we have to run things like placebo controls and things like that. How do you think you do a placebo control for acupuncture? Because normally with a pill, I can just give them a sugar pill versus an active drug and get a placebo effect. What do you think with acupuncture, what you could do? It's actually, I asked a question myself because I had no idea. I was like, well, how in the world can you fake acupunctures and their needles being jabbed into you? they know what they're getting needles in them. And actually, a lot of it has to do with placement. They have sham placements where for osteoarthritis, they're placing them in certain spots. They'll just put them in random places, right? And so that would be one way you can control for that. But you have to look for other examples as well, right? So maybe people are just being polite. They're saying, oh, wow, this person took like an hour to put all these needles in me. Yeah, I feel better. Or perhaps, they had other changes in things like exercises or medications. And so just you have to control for these things, right? Because again, you may find a positive association that may not be completely due to that intervention. It could be due to something else. And so researchers should be looking for that sort of thing. So, and again, why are statistics so difficult to learn? Well, a lot of times people have a fear of math. Math is hard, I agree. And guess what? You don't have to do a whole lot of it in this class, right? So as long as you can do basic addition, subtraction, maybe multiplication and division. Actually, you don't have to do a lot of calculations to come up with things like standard deviations. You have to be able to interpret them though, right? So if I ask you to interpret a standard deviation or a p-value, that's what you need to be able to do. And that's what I'm trying to get out of you during this class here. There's also a lot of confusing terminology, which we'll look at, a lot of abstract thinking, and the terms of using, and again, students hate this, like they hate dealing with uncertainty, but we're going to talk about probability as being the main thing we're looking at here. So again, looking at the fear of math, as long as you can do basic chemistry, you're fine. Now, if you think about it, like you as a clinician working out there, and say you order a CBC, do you know how to run that CBC yourself? They plopped you in the lab? No. But you can still interpret that CBC, right? You still know the white count's up, the patient may be infected, okay? Do you understand how to actually irradiate a patient to get a good x-ray? Probably not. Someone else knows how to do that stuff, right? You just need to know how to interpret those images. You need to know how to interpret those lab values. And so again, here, when you see a p-value being listed out, you don't need to know how they got that p-value specifically. You just need to know how to interpret those values and how to say, okay, well, this test obviously did this, or this treatment obviously did this, based off of the results they showed there. Okay, there's also a lot of confusing terminology, and so some things we use here in terms of biostatistics may not apply to the outside world, right? So when I say something is statistically significant, what does that mean? Well, it means that it is unlikely to happen by chance alone, but then we'll look at things, you can have a 1 millimeter mercury change in blood pressure be statistically significant, but does it matter to you as a clinician? Probably not, right? So we're talking about things like clinical significance versus statistical significance. We're going to talk about things like error. Normally, when you think of error, what do you think that means? I made a boo-boo, right? Here, error just means random variability, right? It just means that you're going to find random variability in everything that you do. That's just how the world works, right? Talk about things like fit, confidence, etc. Again, we're going to build up your confidence when you can use the terms like confidence appropriately in this class, okay? So again, the jargon is going to be something we're going to learn along the way. Okay, and then again, a lot of abstract thinking here. So you have to think in terms of things like populations. And when I say population, what does that mean? You mean like the population of Earth, of the United States, of PA students? It could be anything, right? Populations are something you're going to be defining based on the studies that you're looking at, right? So your population may just be people who live in Orlando. It could be people who have osteoarthritis that have an amputation. It could be anything, right? We'll talk about things like probability distributions and null hypotheses, and again, kind of work around this abstract thinking to make it hopefully a little more concrete in your minds there. And then this is one of the big things that's really tough in terms of talking about probability and not certainty. So I actually had this happen in a sim not too long ago where we were doing a simulation. We had students there that were kind of about to either, I can't remember if it was the first or second years, but one of the patients was an actor, and they were like, am I going to die? Am I going to die? And the student said, no, you're not going to die. Can you say that for sure? No. You'd like to think your patient's not going to die. Who knows? Maybe they get struck by lightning in the middle of the ER. Can't say for sure. Unlikely to occur. But you got to talk about probabilities, right? I think it's very unlikely that you're going to die. We're going to do everything we can to keep you alive, right? These are things you have to learn how to speak in those ways because you don't want to lock yourself into a box, right? Because again, nothing is certain in life. Except for, I guess, death and taxes, they say. But it's one of those things where you have to be able to talk in probabilities. And again, it's okay. You don't have to say you're certain about everything. You're able to say, well, I think it's this. I think it's most likely going to be this. The odds are that this is going to happen, but you always got to leave yourself a little bit of an out there because, again, there's always going to be random chances something else is going to happen. Okay, so kind of getting into some more specifics here. So, again, talking about samples and populations. What do you think is the difference between a sample and a population? Sample's small, yeah, it sounds smaller than a population. Usually a sample is going to be a subset of a population, right? So you define the population, but then in order to run a study, you have to be able to grab a sample out of that group there, right? So for instance, I could use U63 as a sample of the entire PA student population, correct? Now, do you think you'd be representative of the entire sample, or the entire population, I should say? Maybe. I mean, in some degrees, you may be, right? However, maybe because we're in Florida, maybe it skews a little differently, right? Maybe we have different requirements for prereqs, and so that may skew our sample a little differently than you would see in, say, in Texas, or say in Utah, or anywhere else. So that's one of the things we're going to look at to see, like, well, how representative is our sample of this population? And that's really important, because when you start to take information from the sample and apply it back to that population, you need to know how applicable that is, right? So these are things to consider. And again, depending on how you're talking about it, samples and populations may have a little bit different definition here. So for instance, if you look at quality control, or like political polls or clinical studies, I'll kind of go through a few examples of these here. But again, this is some of the specialized meaning that you're going to see with some of these terms here. So in terms like quality control, right, you have a sample that, again, should be representative of the larger population there. So for instance, if you're having, if you're producing cars or something, do you test every single car that comes down the line? No, maybe take a subset of that. That's your sample, and if they look good, you say, okay, well, the rest of the line must be pretty good there, right? And again, you're using those results and trying to infer it back to the entire group. That's oftentimes what we're doing, because in doing clinical studies, it's really tough to get high or large sample sizes, as you're going to find. We'd like to maybe, you're dealing with hypertensive patients. That's a huge, wide, very diverse sort of group of people. To get a sample that's absolutely representative of that whole population, it's really tough, as you're going to find. And so it's always important to look back to see, like, well, these studies, who are they doing them in, and are they representative of that population, and are they applicable to my particular patient? In terms of political polls, and again, this is at least somewhat applicable, since we're going to be coming up with some political races here coming up soon. But again, when you take a random sampling of voters, how representative are they of the larger population you're interested in, right? So I took a group of people from, say, Orlando, and I asked them a bunch of political questions. Do you think that would be the representative of the entire population of Florida? Actually, no, very, very much be very different, as you're going to find out. Especially some of the backwoods areas of Florida might be skew very different than some place like Orlando might, or say Miami. And so in these cases here, again, you have to know who you're looking at, who you're actually polling, and how that actually applies back to the larger population. Look at things like clinical studies, which is, again, where we're going to mainly be focusing our time. Again, we're taking a random sample. Now, the random is a really important bit. Why do you think that is? Exactly. Bias is going to be a big thing we're going to talk about. What is bias? Yeah, basically, it skews the data one way or the other, right? So again, if I were to say, if I want to take this group here, this group of 63, and I only pull, say, 5 females out of the group, and I try to make inferences about the rest of the group, that might not be representative, right? That would include bias, because I don't get any of the male students in the group, okay? Now, actually, when I first started teaching here at Nova Orlando, you know how many male students were in that class? 4 males out of the whole 64. So if I'd taken 5 female students out of that group, that would actually be more representative of the entire population of the 64, because there are a lot fewer men here. But nowadays we have a lot more male students here, I should say. I'll frequently call it patients on accident, but more male students, and that would not be the case, right? So things can change over time. Populations change as time goes on, as you're going to see there. And again, by taking that sample, we can then extrapolate information out of that group back to the larger population. So you have to know, how many people do we pull? Was it randomly sampled? That way we try to avoid outliers and things like that. And again, we'll define these terms as we go along. So again, always be wary. Who are they actually looking at when they perform these studies? Now, what can our calculations not do? Well, again, if you're just running, say, a basic sort of a simple experiment here, again, you have to define the population that you're interested in, right? So if you're doing pediatrics, you're only looking at pediatric patients here, right? Again, you want to randomly select a sample of subjects out of that group, right? So you want to pick people who are representative of that population. But you got to be random about it, because otherwise you can introduce that bias, as we mentioned there. And then for that treatment, if we want to run that, we'd take half the people, give them one treatment, and the other half we would give them some sort of placebo, right? Now, why did we do placebo in the first place? Why can't we just give the person like nothing? What is the placebo effect, though?
Make sure it's not their mind.
Exactly, they're not their mind, right? So again, this is why it's really hard, especially when you talk about like depression meds or medication for anxiety and depression. Oftentimes, just by the act of taking something at all, even if it is just a sugar pill, you feel like you're doing something for your health, and guess what? Your mood does. it can improve in some cases there. So that's, again, frequently why we look at placebo-controlled trials to make sure that the drug is actually having effect, because the human mind is quite powerful, right? So you can have a lot of mind over matter sort of situations where someone feels like they're doing something good for their blood pressure. They're more calm about it. Guess what? Their blood pressure comes down, right? So again, these are things we're trying to control for when we do trials like this, okay? And then, again, once we are looking at that, we're going to look at usually, like I say, a single variable in each subject, whatever we're curious about, whether it's blood pressure, or whether it's serum cholesterol, whatever it happens to be. And then once we take that data, then we're going to then extrapolate that back to the larger population and say, okay, well, I had this study where I gave this one drug to this group of patients, and it looked like it was really effective. If I use this in my patient, it should also be effective in them as well, right? Because, again, we're trying to take that information, apply it back to our individual patients we're dealing with. So again, we're going to find that we run into all kinds of problems with this. Doing studies is really difficult. It's also really expensive in a lot of cases here, so it's hard to design some of these studies. Let's say, for instance, we wanted to try a brand new drug to see whether or not it was effective in treating patients with HIV. So in this case here, could I say, for instance, get every single patient who ever has HIV at one time for a study? You're never going to do it, right? So I have to get a smaller subset of that population, right? Hopefully it's representative of the larger bunch. And the question is, well, okay, do I give half of them treatment and half of them placebo? Is that ethical? No, a lot of times you have to consider, well, no treatment is completely unethical because I know that's going to have a serious harm on the patient. So oftentimes I have to use the gold standard treatment versus whatever experimental treatment I'm trying there. So that's one thing that could be a problem. It could skew your data, so to speak. And the question is, well, what are you going to use as your endpoint? How effective is the treatment going to be? Is it going to be lifespan? You have to follow those patients for decades, potentially. Is it really easy to follow those patients for decades? No, right? So we can use other things. We can use things like surrogate markers, like looking at their CD4 count. We can look at their viral load. We can look at things like that in order to get better ideas. So again, these things are difficult to do. And again, when you find a big study that says, hey, we were using 10,000 people in the study, you should really look at that because it probably has some really good information coming out of that versus something where they had 10 patients they followed for like 6 months. Like, that's more difficult to extrapolate a lot of good information out of that. So again, realistically, you're going to find that you would have limited access to the population. So say, for instance, you're out in California, maybe you were looking at patients with HIV that were, say, 20 to 40, who were living in San Francisco that came to a university clinic, right? Already you're starting to exclude a lot of patients that you may be curious about, right? People are outside of the age range. People live in different parts of the country, things like that. Also, people who come and volunteer for trials can be a form of bias, right? Versus people you just got to randomly select out of a larger group. So that can be really tough too. So anyway, and again, you can take that information using something like CD4 count and then extrapolate that back to the larger population. And again, sometimes we can use multiple studies, pull them together, and get better ideas. If you ever heard of a meta-analysis, that's kind of what we do. We use disparate pieces of information, different studies, pull them together to kind of see what kind of results we can get from that. So anyway, yes, sir?
So that's what that assignment is in the summer? Meta-analysis.
It's sort of a it's more of a meta-analysis implies you're doing more statistical testing than what we're going to be doing. Like, it's actually running homogeneity testing, and you're actually looking for things like the differences between the studies and whatnot. We're not doing that so much, but more so we're doing a literature review, right? So we're kind of taking different information, saying, well, in this study they did this and they found this information versus this study they did this and found this. Ultimately, I think that this is the right way to manage these patients, or whatever the case may be. Yeah, so it's less intensive than a meta-analysis, but you can kind of sort of think about it being along that spectrum for sure. Yeah. Anyway, so again, some of the challenges though that you run into is, what if your population is much more diverse than the sample that you have? You have to mention that. You have to talk about the limitations of a study always, because if you read an article and they don't mention any limitations, they're probably lying, right? They're probably trying to hide some information that may make their data a little weaker than what you might think it actually is based off of what they wrote. But again, think about the measurements they're taking. Think about, is it a good surrogate marker for what you're looking for, et cetera. And when you get into your field, your specialty that you're interested in, you're going to find that you'll kind of pare down into what kind of articles you're really looking at. So for instance, we're going to look at a wide variety of articles here, but by the time you get out there and say you want to work in derm, you may be just really well versed in just the derm literature, and that's totally okay because that's your thing, right? I'm really well versed with the toxicology literature because that's my main interest. That's what I really care about. And so you'll find that once you get into your specialty, you'll tend to more look at a fewer number of articles. So anyway, always be really careful when you're looking at statistics and they make claims that are too good to be true, because frequently they tend to be. Be very careful. You'll see terms like probably, most likely, almost certainly, you need to be careful, make sure their statistics actually back that up. Look at their data, look at their p-values, look at their confidence intervals, and that will give you some better information there, right? Be very aware if they're ever 100% definitive, like this is going to lead to this fewer deaths, or this is going to lead to this much better treatment, etc. Be careful with that, right? And anytime someone says statistically significant, always double check to make sure it's also clinically significant. Again, this is just kind of a preview of the more details we're going to go into later. So now when I say probability versus statistics, again, we're going to find that when we're looking at a sample, again, these are the probabilities we're going to be coming up with, and then we generalize that out back to the population there, right? And again, say for instance, we're looking at a population where if we want to get inferences about that population, we have to look at a smaller set, right? So again, we go from more general to more specific terms there. Say for instance, we're dealing with models, right? Say we're modeling something out like renal function or whatever the case may be. Again, we're going to go back to the data there. So typically, we're going to be going to those more kind of specific use cases there. And then those are the probabilities. When we get actually into the statistics, this is where we're going to be taking it and moving it back to the larger population there. So when I get confidence intervals and p-values, we're going to be saying, well, how does this sample actually size up to the whole population, as we'll see. And again, this will make more sense when we get into the specifics. So that's the first lecture set, just a brief introduction. Do you have any questions before I let you go on a 10-minute break? Let the steam out of your ears for a few minutes. We'll come back and then we'll get into, again, kind of defining a lot of the stuff we're going to talk about and talking about variables. Okay. So we kind of saw the forest. Now let's kind of get down and zoom into the trees a little bit, right? So that way we can make sure we got all the lingo and the definitions down and all of that. This thing's going to be focusing mainly on talking about variables, right? What's a variable? The metric you measure. Yeah, those all can be correct there, right? So I know here's the objective we're going to hit. Starting off talking about types of variables you're going to run into. So the first thing to define would be what an independent and a dependent variable is. Now, some of this might be a review for you, so that's totally fine. But what is an independent variable? So it's something we're studying, true. Is it something that we're going to be measuring, something we're finding out, or something that the experimenter is determining in their setting in the study? In the worst setting, right? Yeah. So again, when you're looking at, say, I want to run a study and I want to look at, say, blood pressure changes in patients either receiving lisinopril or, say, hydrochlorothiazide, right? We'll learn about those drugs later on. But what is the independent variable there? What drug they get, right? If they're getting this drug or this drug, that's going to be basically the independent variable because I'm the researcher setting that as my independent variable. It's independent of anything else because I set it, right? The independent variable is going to have an effect on the dependent variable. So again, it's dependent because it's going to be based off of whatever the independent variable is. So in this case that I mentioned, where I'm giving 2 antihypertensives, what would be the dependent variable I'm looking at? It'd be the patient's blood pressure, right? So whatever change that would be in the blood pressure would be the dependent variable. Pretty straightforward there. Now again, if I was looking at different analgesics, you may find that which medication they give again would be the independent variable. How the change in pain scale, right? So if they went from a 10 down to an 8, or if they went down from a 10 to say a 4, that would be my dependent variable there. Okay. You may find that studies can have multiples of each, right? You may be looking at, say, which drug they get and gender could be my independent variables, right? You could be looking at age groups. You could be looking at race. You could look at anything, and then the dependent variables also may be multiple. So I could be looking also, change in pain scale, but you could also look at things like ability to return to work, or you could look at things like, other functional outcomes. Those are all things you'd be looking at. So you can have multiples of each, and it's important when you're looking at a study, okay, which ones are my independent, which one are my dependent variables? Okay, getting into the different types of those variables there's nominal variables. What does that mean? Nom just means the name, essentially, right? So again, it has no bearing on the order of magnitude of anything. There's no implicit order in the different variables. They're just named. They're just in random buckets, essentially. So in this case here, blood typing, right? So is A blood better than B blood? No, there's no inherent difference between them. It's just they're different, right? They're just different names associated with that. You can do it with eye color. You could do it with gender. Anything can be a nominal variable as long as it's just a name you're applying to it. Type of car, anything like that. Now, when there's only two of those nominal variables, it's called a binomial variable or a dichotomous variable here, right? So in some cases there you could consider gender, although that is obviously changing. So depending on how the researchers define gender, they could say it's male, female, right? And that would be a dichotomous sort of variable there. Or something like, do you like this class? Yes or no? Obviously it would be yes, but that would be a dichotomous sort of variable there, right? Again, it's ultimately nominal, but it falls into that more specific category of dichotomous. Now, next we have your ordinal variables. What's an ordinal variable? So we're starting to get into numbers potentially. Always not necessarily, but there's an order to it, right? So when you're writing out your evaluations for a class, right, and you're saying, well, how much do you agree with this statement that the professor is really good at teaching epidemiology? You say not very good, or strongly disagree, all the way up through strongly agree. There's an implied order there, right? Obviously strongly agree is better than strongly disagree. That's an ordinal sort of variable there, okay? So poor, fair, good. Again, the problem though is you can't really adequately define, well, how much different is poor to fair versus fair to good? Because there's no kind of explicit difference between those, and it could be variable there, you're going to find that there's not a good way to really look at that in terms of just explicit numbers, as it turns out. And we're going to look at ways we can interpret these when we talk about things like medians and modes and all that kind of good stuff. So that's an ordinal variable, right? Anything with an order to it, but there's no implied magnitude between those different variables. Then getting into continuous variables, what's that going to be? Well, things are going to be on a continuous sort of scale, right? So looking at a blood pressure would be a continuous variable, right? The difference between 110 to 100 is the same as the difference between 90 to 80, right? It's still a 10 millimeter mercury of difference between the two. It doesn't matter how far up or down on the scale I get there. It's a continuous variable. That difference is always going to be the same from value to value, right? So that's kind of the big difference between that and ordinal. Ordinal just implies an order. It doesn't tell me anything about the magnitude of difference between each point along that scale, okay? Weight can fall into this. Temperature, really anything that can be on a numbered scale can fall onto that, okay? There's two kind of subsets of continuous variables, is what we call an interval variable, and then there's also going to be a ratio variable, which we're going to see in a second here. An interval variable, and people always kind of have a hard time with this one, but it's important because it'll tell us what sort of statistical analyses we can do on these variables, as we'll see in a second. With interval variables, they're continuous, right? So again, the order of magnitude between the different values is always the same, no matter where you're at on the scale here. But here, the 0 point is not considered to be meaningful, right? You can also think about certain types of temperature as being this as well. So for instance, like IQ, right? Can you really get a 0 IQ? So you may feel like you have it sometimes, but it's not really true, right? There's no really good 0 point there. However, what about like temperature, right? Does having a 0 degree Celsius temperature mean you have no temperature left? Well, no, because you have negative temperatures, right? So because of that, that is considered to be an interval variable. Now, with Celsius and Fahrenheit, those would be considered interval variables. What about like Kelvin? Temperatures in Kelvin, would that be considered the same? No, why not? Because once you hit absolute 0, there is no energy left. You cannot go below that, right? So that would be considered this next category we're going to talk about in a second. But again, depending on the type of continuous variable you're looking at, it could be an interval variable. Just consider whether the 0 actually means anything or not in terms of that, okay? Yes, sir.
This is on like it has to be continuous as well, not like.
Has to be continuous, yeah.
The 1 to 5 scale for a restaurant might not have any meaning to it, but there's only 5 or 6 answers.
Yeah, so if you think about like it's like a Yelp review, like you go to what's a good restaurant around here you can go to? Pearls, okay. Or I'm gonna think of somewhere. How about if you're into anime? There's one I have not been to yet, but it's called Super Saiyan. Oh, is it really good? I would like to go one day. But anyway, so if I wanted to go write a Yelp review, I could get between 1 and 5 stars, right? So how much better is a 5-star review over a 4-star versus 4 versus 3? Hard to say, right? And it could be based on a lot of different things, but because there's no inherent magnitude between a 4 to a 5 and a 3 to a 4, that's why we still consider an ordinal sort of thing there, right? So, but interval variables only applies to a continuous variable there. So if I went to check the temperature of the ramen at that restaurant, that's a continuous variable, right? But if I measure it in Fahrenheit, if it was very cold, then it may have like a negative temperature to it. It wouldn't be very good ramen. They probably get a 1 star. But that would be, again, the 0 point doesn't matter, so it'd be an interval sort of variable, right? Again, this one is a little less intuitive than something like ordinal versus nominal, but again, this is important. I'll show you a graph or a table that kind of makes a little bit more sense out of this. Just think, does a 0 make any difference? Is it actually an endpoint? If not, then it's probably going to be one of these interval variables. Here's an example here, and again, data can be misrepresented pretty easily depending on how you put it on a chart. So for instance, here you're looking at temperatures of different animals, and again, I don't know, where do you even get your hands on a platypus? Maybe this is an Australian study, who knows? But if you're looking at average resting body temperatures of these 4 different species here, what do you think is the difference between graph A versus B in terms of like actually looking at the difference? The values are the same between these two, but which one looks like there's bigger differences? B looks like there's bigger differences, right? But what's the difference between these two here? The scale is different, right? So again, when I shrink the scale down, you can make it look like, well, look how much colder the platypus is than the canary. I don't know what sort of clinical, again, this is out of a book. I did not set these up. However, you can say, wow, this platypus is way colder than a human. But if you look here, on this scale, it doesn't look that severe, right? So again, this is one of those ways that data can be manipulated based on how you represent it, to where when people look at it, they'll be like, well, there's not a whole lot of difference in graph A versus, wow, look at all this difference here. That's, again, they're the same values between the two there, but because that 0 point doesn't really make a difference, because temperature in Celsius is going to be one of those interval variables, it's not really a good best way to represent that sort of data, right? So next we have the ratio variable. So this is going to be a case where you can have the 0 actually does matter in this point here. So like, for instance, blood pressure, right? You can have a pressure of 0. Could you have a negative pressure? Not really, right? You're a patient, you have a blood pressure of suction, I guess. That'd be kind of strange. But they can sort of have a 0 blood pressure, right? They're dead, for sure. So again, this is why it's a ratio variable. It basically implies that because that 0 really does make a difference, we can start to do ratios in our evaluations of those things. I can divide one value by another, and that ratio actually makes sense. And you're doing like via Celsius in temperature, because you can still have negative values there, it doesn't really make a whole lot of sense. So this is important, right? And so if you're looking at things like distance, mass, body weight, right? You can't have a patient that weighs negative weight, right? Otherwise they'd be floating, I guess. Right, so again, the 0 matters there. That's why it's considered to be a ratio variable. So this is a good table to refer back to once we kind of get through and talk about the different types of statistical tests we can run on these. We're talking about the observational sort of statistics here. So again, we have nominal, ordinal, interval, and ratio. Remember, these two are both continuous variables, right? So again, they're on a continuous scale. The order of magnitude of difference between one value to the next is always the same no matter where you're at the scale. And so here, okay, so looking at this, a frequency distribution, what do you think that is? You're just counting it, right? You're just saying how many times does this value pop up. That's a frequency distribution. With nominal, I can say, yes, there are so many males and so many females. I can say there's so many dogs and so many platypi. Is that the plural? I'm not sure. Anyway, huh? Does that sound right?
It is now.
It is now, or you just made it up. Anywho, so we can do that. We can say with an ordinal, I can count how many times a student says they strongly disagree with the fact that I made this class somewhat bearable, right? I can count that sort of thing there. Same thing for interval and ratio, okay? So that's easy enough. Getting into things like medians and percentiles. Anyone know what a median is? Besides the thing in the middle of the road? It's kind of the same. It's the middle value, right? So if you were to line up all the values from low to high, you would get that middle value. That's the median there. You can't really do that with a nominal variable. Why do you think that is? There's no order to them, right? Again, I can't say that a Ford is greater than a Chevy or vice versa, although some people have strong opinions about that. Again, just by types of cars, just by something going by name, I can't necessarily apply any kind of order to that. So that's why there's no medians you can develop with that. However, with ordinal and continuous variables, you absolutely can do that. Okay. When you're looking at adding and subtracting things, again, this is something you can only do with continuous variables. I can subtract 2 temperatures from one another. I can subtract 2 weights from one another. That's totally okay to do there, okay? Now, when again, getting into the ratios, and when I say ratio, what does that mean? Just dividing one thing by another. You can only do that with those ratio variables there, right? So again, that's an important consideration here. If I'm looking to divide one thing by another and doing a test like that, I need to have a ratio variable there. So blood pressure would be okay to do that with, weight would be fine, but degrees in Celsius would not, okay? Because that's going to be one of those interval variables, okay? And then we're going to get into stuff talking about means. What's a mean besides what I am to you? It's the average, right? With the average value out of that. Now notice here, you can't really get that out of an ordinal variable. Why is that? there's no real numbers to it, right? So again, you can order them up and I can get the median value out of that. But again, if you're looking at it, there's no implied magnitude between the different values. You can't get an average, right? So I can get an average value out of a Likert scale like you would get on a Yelp review or something like that, right? However, I can do that with continuous variables. Okay, so I am able to get means. We'll talk about standard deviations and standard error of the mean a little bit later on, but those are the things I can get out of that. And then we'll talk about coefficient of variation. That's only going to be available with the ratio of variables. So again, these are kind of key points to look back at when you're reviewing this stuff and to see what kind of things you can take away from this type of information based on the variable. Okay, how do we graph some of this continuous data? So when we're doing this, when we're looking at continuous data, again, we're looking at things like enzyme activity. We can look at oxygen saturations, all these different things. One of the things you want to do is try to visualize the data, because again, people are better when they're looking at charts and graphs and things like that. They can make better sense of it than just looking at pure numbers there. And again, it's much more common to do it with continuous data than you do a lot of other types, as you'll see. So again, here's an example where we're measuring body temperature, and this is kind of an example we'll kind of go back to pretty frequently. But we're measuring body temperature, and we did it in hundreds of healthy individuals to see what a normal temperature range is. Okay. Now, what's a normal body temperature for a person? It's at 98.6, right? How about in Celsius? Anyone know?
37.
Yeah, so like 36 to 38 is usually considered to be like pretty normal, right? So again, do people fall outside of that? All the time, right? So again, there's always going to be some ranges with this stuff, and we'll show you what that kind of looks like. Because again, you want to look at the spread of data. You want to look to see how far spread out they are from what that considered that normal is, that 37 in those cases there, right? And again, you can calculate the average pretty easy because I can just add all the values together and divide by my total number of participants I looked at. What's that normally abbreviated as? I'm looking at the number of people or the number of values I was looking at. N is usually the variable there. So if you have an N of 30, that means I had 30 observations or 30 people that I did that study in, right? So N is an important feature there. Anyway, so looking at this, say I were to look at an even smaller subset of those individuals. I got 12 people out of that group, and I went ahead and got the mean out of this. So I took all these values together, and then I divided them out, okay? Now again, we're going to find that how generalizable this is to the larger subset is going to be questionable depending on if I have any outliers. And when I say an outlier, what does that mean? Yeah, something that falls far away from the average, right? So again, if I say the average temperature is 37 degrees centigrade, and I say I have someone who is clocking in at 35 degrees, that may be considered an outlier, right? Because again, they're going to be skewing the average one way versus the other if they're very high or very low, as the case may be here. And so what we're going to find is when you look at a mean, which again is just an average of all those values together divided by the total observations, these are very sensitive to outliers. Okay? Say sensitive to outliers, what does that mean? It's going to affect it pretty easily, right? So again, if I have one really high value or say one really low value, you're going to find those outliers can really skew your mean there. So in this case here, the mean value was 36.77. What if I had someone that came in, maybe they had a fever and they had a temperature of 39 degrees centigrade? What's that going to do to my average? It's going to bring it up, right? So that outlier is going to affect my average, meaning it's very sensitive to that. Okay. Now there are ways we can deal with outliers we'll talk about later on, but it's just important to realize that. And again, it's one of the things you want to look at in the data, see do you have outliers that are there, and how do the researchers actually account for that. Okay. And again, this is trying to quantify, again, just the average here, the central tendency of the data, kind of where the middle is and kind of where it falls from there. Now, you guys have seen a bell-shaped curve before, right? Talk about a normal distribution or a Gaussian distribution. We're going to get into that when we're talking about the spread of data in just a little bit, so kind of keep that in the back of your mind. Now, we're looking at the median. We mentioned this is the middle value, right? So if you were to line up all the values from smallest to largest, and again, can you do this with ordinal variables? Right, just like if you do like your professor's reviews, you can line up all the 1s, 2s, 3s, 4s, and 5s, and that middle value there is going to be the median value, okay? Now, is that very sensitive to outliers, you think?
No.
Why not?
Because you add 1 on the end, the middle is going to shift by 1 as well.
Exactly. So it really doesn't shift the middle, that median value very much. It may only by one spot at a time, right? So just because you have an outlier, even if it's a very extreme outlier, it doesn't shift with that middle value is all that much. So in those cases there, we say that medians are not sensitive to outliers. Okay. That's an important consideration is when we start to do more sophisticated testing there, and we see that outliers can really skew your data. It can really introduce a lot of bias. We can oftentimes look at the medians, and that will be much more resilient and not be as affected by those outliers, as the case may be. And again, when you're figuring out the median, if there's two values in the middle, right? So you don't have if it's a even number of observations, you just average those two middle values there. So sometimes we can try to deal with outliers by doing things like trimming the mean, or sometimes we can actually take the highest and lowest values and try to skim them off. Obviously, you want to be able to know about that if you were to see that occur in a piece of literature. The idea is by removing the influence of outliers, it will make your mean a little bit more reliable there, though. And again, if you could think about something like Olympic diving, right? So by trimming off the high and the low values of the judges, you prevent one person from kind of skewing the entire results there. Is one example. What's the mode? The value that's most common that pops up there, right? I'll tell you that this really doesn't come up too frequently in clinical research. As you'll find, the means, the medians, interquartile ranges, things like that are certainly important. The mode doesn't come up all that frequently, but it's just good to know that's always going to be the most frequent value that pops up there. And it may not always assess what the center of the distribution is. Really, the mean and the median and the average are going to be the best things to do that. Okay, so some other lingo here. So talking about error and bias. We said error is what? Yeah, it's not a mistake in the normal terms. Like if you think about you made a medical error, that's a bad thing, right? Error in the terms of statistics is just random variability. It's going to be present no matter what. It's a question of how do you actually deal with that error as it presents itself. Bias, we said on the other hand, is what? Skews the data one way or the other, right? So again, that can be a systemic issue with how I run a study, right? So for instance, if I wanted to evaluate PA students in Orlando and I only picked male students or female students, that may skew my results. That's a form of bias, right? Or if I only say took students who were in, they got the Dean's Award or whatever the case may be, it can skew my results. That's a form of bias. Error is just that random variability that occurs in just in nature, right? So again, looking at this in the next figure, we'll look at the temperature ranges in that larger subset, and we'll see that it ranged anywhere from 35.7 to 38.2 degrees centigrade there. Now, why do you think there is that variability? Why do you think people range between those extremes there? Could be a lot of things, right? So just circadian variations, right? We know our body temperature changes from time to time throughout the day. It could be one thing. Age can play a role there. Older people generally run hot or cold. You're a little bit colder there, right? It's when I go to my parents' house and it's like they leave it at 80 in the house. I'm just like, what is wrong with you people? It's because they lose some of that temperature regulation, right? Diet, mood, all these things can play a big role there. Their activity levels prior to testing. So again, that can be some form of error there. Now, if I had someone that just ran up a bunch of flights of stairs and I checked their temperature, is that error or that could be a bias? Could be a form of bias, right? Because you may want to stipulate, okay, everyone has to sit nice and calm in a room for 30 minutes before they check their temperature, right? These are things that you can try to account for when you do these sorts of research. But ultimately, you're going to get that data back and you're going to get some degree of scatter around that, right? And that's going to be that biological variation you're going to see there. And again, this is what all the samples will look like, and then this is that N of 12 that we kind of pulled out earlier. So what do you kind of notice about the difference between these two? Which one is it easier to estimate like a mean value? In the larger sample set or the smaller? The smaller or the larger? Probably the larger one. It's very clear. Okay, the mean's probably somewhere around this range here versus this one. Because you have some of those extremes, I don't know if this outlier is maybe pulling that average down. But think about it. The larger the sample size that I'm dealing with, the more likely I am to get it close to the actual population that I'm interested in, right? So because the larger the sample size, the more of that population you're actually including, the more likely it's going to be representative of that. That's why we like bigger N's if ever possible. If you see a study with like 10,000 participants, that's generally a pretty good study to have an idea of what the actual population is doing. If I have an N of 10 in a study, I have no clue, right? A lot of times you'll find like a lot of college-based research studies, like, you know, I see a lot of studies coming out of like sports medicine programs and things like that. They're like, oh, we looked at 10, college-trained athletes. Okay, that's great and all, but like it may not be necessarily applicable to a larger population than just that. So again, N is really important here in terms of how representative is going to be of that larger population. Okay. Again, this is just one way to show scatter. Obviously, we can do this with just the numbers by showing the high and the low values along with the averages there. But again, this is just one way to do so. Okay. So again, some variation. Maybe due to experimental error, right? So for instance, if I were getting, say, oral temperatures on the majority of the people in that sample set, but then for a few of them, someone missed the memo and they end up getting rectal temperatures. Could that skew your data? Right, because which one's a more accurate form of core temperature or reading of it? Rectal, right? So again, that could skew your data. It may skew it higher or lower depending on the situation there. But again, that variability is expected. We know about that. Usually with actual study design, we can try to eliminate as much bias as possible. There's always going to be some bias that's going to be present regardless, right? And again, it may not just be that we designed it wrong. It could be something like, what if your temperature probe was reading incorrectly, right? Maybe reading high or reading a little low, okay? I just experienced that when I moved houses recently. I was like, I always cook chicken the same way. Every single time. The oven's always at the same temperature. I moved to this new house. Guess what happened to the chicken? It got all dried out and burnt. I was like, oh man, the temperature read wrong. And again, that was a form of bias, right? The temperature was just reading incorrectly, and I had to account for that. So these are things, right? Sometimes we can account for it, sometimes we can't when you actually run these experiments. So again, other ways we can try to show that scatter, because again, when we were looking at that larger sample set, looking at all those dots, sometimes it can be a little difficult to determine exactly where things like averages were, the medians were, etc. And so sometimes you can use graphs like this to kind of tell you a little bit more information. It's a little more descriptive. And so we call these box and whisker plots here. And so this can tell you, bigger degree of information in terms of things like the range. So for instance here, these are going to be the upper and lower ends of the range here. Oftentimes they'll put like the average value right in the middle of that box, and then what do you think these are? Q1, yeah, basically you're right. So that's interquartile ranges, right? So that's the 25th and the 75th percentile values there, right? So again, it tells you how big of a spread there. If that box is larger, what does that tell you about the spread of data? It's more variable, right? If it's very tight around the average, it would usually mean it's much more less variable, right? Sometimes they'll do it where they maybe put the outliers here just to kind of illustrate some of the extreme values. There's a million different ways to do it. The big thing though is you want to make sure you're actually reading the legends there at the bottom to determine what specifically you're looking at, right? To make sure you're not going to be misinterpreting the data potentially. Okay. Okay, other things you can look at. So you can look at things like frequency distributions to see how many people actually showed up with a certain value here. And again, this is another way that the data could be misrepresented or maybe not as clear as it could be. So for instance, this is all showing the same data here, but what do you think is the difference between the different graphs? Basically how you're divvying up all the patients into those groups here. So for this one, everyone with a temperature in the range of 36 got into one lump, right? Everyone with a temperature of 37 got put in this other group, and then 38. Is this very descriptive? Not really. I know most patients are around 37, which is all well and dandy, but if I want to get any better idea of the actual spread of data, I would have to divvy up those patients into further groups here, right? You can't really tell outliers too well with this group either. Versus this one is a little bit more descriptive, and then here I get even a little bit more granular with that. The point is you want to find kind of the happy middle ground where you're able to get a good feel for the data without getting every single point put on there, and it doesn't really people kind of glaze over after a while, kind of like what you're doing right now probably. Okay, so how to quantify that scatter that we're seeing in the data here. So this is where the standard deviation comes up. And again, now we're starting to get to the scary terms like averages and medians. Everyone's all very familiar with that. Who's dealt with standard deviations before? Okay, so we've heard of it. Do you guys know how to calculate it? Oh boy. Yeah, you use a computer. That's the exact right answer. Use a computer to get your standard deviation. That's what I do whenever I need to figure it out, and it's not too frequently that I need to do that. So, but the important thing is knowing what that standard deviation is. Anyone know what it means? How far away the data is falling from that average value, that middle value that we're looking at there, right? So standard deviation is, again, expressing that variation in the values, and it'll be important to understand that when we're talking about normal distribution curves and a little bit later. So again, it's telling me that measure of spread around the mean. So a large standard deviation means what? It's a large variability around that mean versus small standard deviation means a very small amount of spread, right? More people were closer to that average value versus fewer people, right? So again, larger the standard deviation, the more spread. So if you were to look at a normally distributed bell-shaped curve here, right, this is the Gaussian curve, which we'll talk more about in detail here, and the average is obviously going to be at 0 in this point, right, and for this scale here. And so what you notice is that when you have a data set that is normally distributed, most people fall close to the middle, right? So most people, if I took your temperature right now in Celsius, your temperature would be probably pretty close to what? Probably close to 37, right? Certainly there's going to be people that fall outside of that, but most people be pretty close. And so what you find is, and this is good numbers to remember, is that when you're one standard deviation away in both directions, you get about 68% of the people should fall within that group. Okay, 2/3 of your observations should fall pretty close within that. Okay. When I go 2 standard deviations out, anyone know how many people I should be capturing? What percentage? At 95%, 2 standard deviations out. And then how about if I go out 3 standard deviations? 99%. Now, again, can people fall outside of that? Of course, people are always going to fall outside of the average here. Just because you see what a normal value is for a laboratory result doesn't mean that everyone falls into that as abnormal or falls outside of that as abnormal. It just means that they don't fall into that normal range, right? So again, these are things we're going to be looking at in terms of like how far away do these values fall outside of that average, and this is going to help us to determine, okay, well, the results that we're finding because I introduced a new drug and I changed the blood pressure, is that just due to random chance? Or is it because I actually introduced something that really lowered that blood pressure more than something else, right? So we'll talk more about that later. And again, then 2/3 of the observations should be within 1 standard deviation above and below the mean. 95% should be within 2 standard deviations, and 99% within 3. Okay. Why is 95% so important? Talk about our alpha level, right? So again, we're going to talk about things being meeting a p of less than 0.05, right? That 5% is really what we're going to be looking at. It's going to be a value that's going to come up again and again. Again, so just keep that in the back of your mind. So again, here's another case here where we're showing the mean. And again, this is the total spread of data here in that temperature example. And again, here's the mean with the standard deviation. Now, what if I were to increase this and I said maybe I was looking at, say, 10,000 people? Do you think that standard deviation would change much? It may not, right? So that's one of the things we're going to find is the standard deviation may not change a whole lot there. There is another value that we'll talk about in a moment that does change the closer you get to the whole population you're going to be looking at. So you can still have that variability there. Standard deviation may not change a whole lot just based off sample size. But again, how do we calculate it? Again, I'm just going to go through this very briefly. I'm not going to expect you to calculate this on the test, but I expect you to be able to interpret a standard deviation and what that means, right? So basically, you're going to take the average of the values that you have, okay, and basically you're just trying to figure out what is the distance between that value to the mean. Every single value you're going to do. And again, this is why computers do this for us. And basically, when you end up getting all these values together, determining that distance from the mean there and calculate it out. Again, I don't want to bore you with all the details here. You're basically going to end up getting that standard deviation, right? So again, this is how you calculate it out. Computers are a wonderful thing. Just rely on those, please. But again, like I said here, the mean value that's in the middle, again, 2/3 of the observations should be within the 1 standard deviation based off the data that you have there. 95% within 2, and then 99% roughly within 3 standard deviations. Okay. Okay, so when we talk about normal distributed data or Gaussian distribution, what does that mean? No. Basically, it's that bell-shaped curve that we're talking about, right? So if you were to take, say, the temperature of every single person on Earth, you should get a pretty good bell-shaped curve there, right? You're going to typically find that when you have data that is normally distributed, you may have outliers, but the nice thing is you're going to have outliers in both directions, and you tend to cancel one another out on either side of that, which leads you to have that nice bell-shaped curve, okay? People fall above it, people fall below it. It's totally normal, right? That's why I call a normal distribution there. And again, random factors will offset one another. That's basically what we're saying with that. And again, because people tend to have a central tendency towards that mean, people will tend to be average for the most part. And so again, most values tend to cancel each other out, so you get that average value there. And so as you'll see, we mentioned that bell-shaped curve already. We looked at one of those. Just the other name for it is Gaussian in terms of the distribution. It's that bell-shaped curve. Here's what the rest of it looks like if you were to actually take it out to its logical extreme. It's old nasty. But anyway, so this is important because when you look at a data set, you want to know whether it's normally distributed or not. Because if, say, for instance, I was taking, I'm curious about the population of PA students as a whole, and I only were to pull female students, do you think that would be normally distributed if I was, say, looking at, say, anxiety levels? It may not be, right? Because I'm automatically introducing bias into that by only pulling, say, one gender of students versus, say, incorporating multiples. And so you're going to find that in those cases there, data may not be normally distributed. And there's ways we can test for that. And we'll talk about that a little bit later. But those are really important tests because if you're assuming data is normally distributed, you run certain tests for that, then and if the data is not normally distributed, you can run into some false positives. And that's when you're going to be making conclusions that just aren't true, as the case may be. But this is what the ideal distribution kind of looks like. And again, if you actually look at most of our tests that we run for you guys, guess what you guys do? Most of you fall into a pretty good bell-shaped curve most of the time if you actually look at the test value. So again, there's an average value, and most of you kind of fall exactly right within that. Now, sometimes certain tests skew higher or lower. I won't tell you which way mine tend to go, but it's a bell-shaped curve regardless. Just assume higher is fine. It's fine. Positive thinking is an important factor there, right? And again, if you were to look at the entire area under that whole curve, that's going to be the entire sample that you were looking at, right? Or if you were to apply that out to the whole population, it may be the entire population, right? So again, frequently you're going to find that the scientific papers that you read out there, they'll show the mean and the standard deviation, but they don't actually show each of the data points. Why do you think that is? It's too long. It doesn't make for very good reading. How do you know that they're not just lying about the data? They're not just making stuff up. Could they be? Possibly, right? We used to think for, the one doctor who was saying that, thimerosal in certain vaccines was causing autism was completely debunked later on. He's fabricating results, right? So how do we know that the data we're reading, say, in the New England Journal of Medicine is correct? Because someone else has gone through it, right? We talk about peer-reviewed journals. That means someone else has actually gone through that data to make sure that the conclusions that they're drawing actually make sense. So when you see peer-reviewed, that's a good thing, right? I mean, someone else has actually looked at it that's an expert in that field and said that it's okay. So for instance, like when I got my research published many years ago, I had to have someone else go through it that was an expert in coral snake envenomation and actually make sure that the data that I was reporting out actually looked okay. Now, when you actually look at the article itself, every single data point that we included was not in there because no one would want to actually read that. You look for the summary information, right? You look for means, standard deviations, etc. And again, based off that, you can kind of assume, if they say so, and it passed certain tests, that it's going to be a Gaussian distribution, right? So, again, as I mentioned, oftentimes you can come up with these z values, and that's how you kind of come up with the 68% for one standard deviation away, 95% for two standard deviations, and 99 for three. Those are those z values we kind of talk about there. Again, these are the big numbers to remember. This can just refer to the standard deviation for our purposes, where the mean is basically at a 0 point in the middle there, right? So again, one standard deviation, 2/3 of the observations, 95% roughly at 2. Don't get too bogged down on the actual values there, but kind of get those rough numbers down, okay? Okay, and as I mentioned, a Gaussian distribution, just another name for a normal distribution if you hear about that. Again, when I say normal in the clinical sense, what does that mean? Yeah, the patient's fitting within whatever predefined sort of averages you've come up with or whatever ranges you've set to be considered normal versus abnormal. When I say normal here, this just means that the data is distributed such that the outliers tend to cancel one another out, right? If I was having a ton of outliers or skewing one way versus the other, then that data may not actually be normally distributed unless I can't use certain assumptions with that data at that point there. So for instance, if I was taking temperatures of the entire class here, and then a couple people had fevers because they recently gotten ill from something, like, that may be outliers, they're skewing that data. It may make it not normally distributed at that point, right? So these are things you have to consider with these groups here. So another value that's interesting here that you want to kind of know is the standard error of the mean. And so this actually incorporates the standard deviation. But what it basically does is try to identify, well, how close is our sample trying to approximate the actual population at large. If I were to apply that information from that sample back out to the population, how close would I actually end up being there? And so basically what this is it's going to be the standard deviation divided by the square root of n. So how could I make this value larger? I could decrease my n, right? So the higher the standard error of the mean is, the farther away I'm getting from the actual population averages. However, if I just try to bump up my n and I try to get as many people as possible, what do you find?
Lower error.
Yeah, less error, right? So again, I'm better approximating what that actual average would be if I were to, say, pull out and look at the entire population, okay? So standard error of the mean is a very important feature there because it takes into account the variability in the data you have along with the sample size. By increasing that sample size, you're more likely to get closer to that population, which makes sense because you're getting more people out of that population that you're looking at, right? So if I had, say, for instance, a study that I ran with 10 people versus 100 people, which one would likely have a lower standard error of the mean? The one with 100 people, right? That means I'm closer to the actual population average. Little doubt that I'm very close to that. If it was close to 0, that means that it's probably going to be very, very close to the actual population average if you were to be able to actually get observations from every single person in that population. So again, this is not going to be that spread of data. That's what standard deviation does, right? So that's a point there I want you to know. Standard deviation is the spread of data about the average. Standard error of the mean is going to tell me how well I know what the population average would actually be. Because again, how often is it you can get the entire population you're curious about, observed? very unlikely, right? So the standard error of the mean is really helpful in doing that. Okay, again, standard error of the mean it just means I'm very, very close to the population mean. Oftentimes it gets reported in the literature just to show us kind of how close we are to that. So small values are very good from that standpoint. The other big thing that's important here is that the standard error of the mean helps us to determine what the confidence intervals are going to be. And we know what a confidence interval is? How confident I am that the value that I came up with is what the actual population, the true value is of that population. And we'll talk much more about those in details there, but keep confidence intervals in the back of your mind, because very frequently you find that standard error of the mean may not be expressed in the actual data that you're looking at, but confidence intervals are going to be everywhere. So you need to have a good understanding of what those confidence intervals are, and we'll talk about those later. We'll talk about that right now, actually. Sometimes I forget the order of my slides. Yes, officially. So anyways, let's continue looking at that temperature example we were looking at before. So again, we have two sample sets. We have the one that's n of 130, and we said that confidence interval. So we talked about the 95% confidence interval. That means that I'm 95% sure that if I were to take the entire population, whatever they were looking at, whatever type of people they were looking at, that the average of that population would be somewhere between 36.75 to 36.89. 95% sure of that. Now, how come I'm not 100% sure? Because you can't really ever be 100% sure about anything, right? You got to leave yourself a little bit of wiggle room, right? So that's why in statistics, it's always probabilities. It's never saying concrete yes or no about something, okay? Now, when you look at that, I can say, okay, well, if I have these 130 people, I got that average, and I think 95% sure that's going to fall somewhere within that range. That's a pretty narrow range there, right? Not a lot of wiggle room there. What do you notice if I look at just that subset of 12 people? We saw there's more variability within that data. And now I'm 95% sure that the true population average falls somewhere between 36.51 all the way up to 37.02. What do you notice with that? It's wider, right? So typically what you find is that you have to give yourself more wiggle room in there, okay? Because you have less people to work with. You're less sure about where the actual population average is, and so you have to give yourself more room. Now, what if I use, say, for instance, instead of a 95% confidence interval, I said I want to be less sure. I said I'm less confident about it. I'm going to go, let's say, 68% confidence interval. What do you think that would do to my range? It would actually get smaller, right? Because then I have even more wiggle room to be wrong. So I'm only 68% sure. I'm not 95% sure. To say that you're 95% sure, that's pretty sure, right? What if I were to say I want a 99% confidence interval? What does that do to that value? Actually get wider there at that point, right? Because again, I'm giving myself more room to be wrong in those cases there if the value actually falls somewhere outside of that. Because I'm being very, very sure. I want to make sure that I capture all those values that it could be. So again, why do we care about this? Because again, when you're trying to extrapolate this back to a population, you can't just say, yeah, I know the average is going to be 37. Likely isn't that. It's probably going to be somewhere within a range because we can't know the whole population. We know this is feasible. We need to come up with a range that we at least come up with and say, okay, at least I'm 95% sure somewhere within this group here. The nice thing about these confidence intervals, now I can use comparisons. I can look between different groups and actually start to make some inferences about those groups based off of whatever the experiment is. Whether there's a new treatment, whether it's anything else, we can start doing it at that point. And again, 100% certainty that the sample mean is calculated correctly. Again, it's an assumption we're going to be making there. And again, this confidence interval is always going to be centered around the mean. Okay. So again, that mean value is always going to be right in the middle between this confidence interval, as we're going to see. We'll look at more data to kind of make more sense of that. Now again, because I could be 100% confident that I said, well, the population average is probably somewhere between 0 and 100 degrees centigrade. Would that be true? Probably, right? Because people aren't frozen and people aren't boiling. So that's probably right. Somewhere the population average probably falls somewhere within that, right? But that's not very useful information. By getting closer to like 95% confidence intervals, this is a little bit more actionable sort of information there, right? So again, I'm leaving myself a little bit of wiggle room. Anyway, and again, this seems abstract, and it is, but it'll make more sense when we get to the journal clubs and actually apply this to actual data and see what this actually means for us. So again, don't worry if this doesn't make total sense to you now. It'll make a lot more sense as it comes up later. So how do we get confidence intervals? Basically, we're calculating from the sample mean. And again, this is based off of the best estimate of the population mean that I have. So if I get more people, obviously I'm going to get closer to that population mean, but this is what I got with my sample here. And we'll see the confidence interval gets centered around that sample mean, right? So it's going to go some degree above it and some degree below it, okay? And then we need the standard deviation. And again, that just tells us the amount of scatter around that mean. Large amount of variability means a big standard deviation. A small amount of variability means a small standard deviation there. Okay. Usually you're going to find the width of the confidence interval is proportional to the sample standard deviation. Meaning there's a lot more variability in that data. You tend to find the confidence intervals get wider, and the less variability, the narrower those confidence intervals get. The other big thing that is going to be important here is the sample size. So obviously the bigger the sample size I have, the more closely I'm approximating the actual population that I'm interested in. You tend to find that also will narrow up your confidence intervals. Right, so bigger sample size means I'm more sure about what that actual population average is. I can then narrow down those confidence intervals and be much more sure within that narrow range. Okay, and then the degrees of confidence. So again, how confident do I want to be in that answer? If I say I'm 99% sure, I need to give myself more wiggle room, right? More values that it could be. If I want to be less sure, if I want to say I'm 50% sure this value, then they can get pretty small in those cases there. Because again, you can be wrong half the time, and that's okay based off of your confidence interval. Okay. Now, do you want to be wrong half the time? Would you like to be right 95% of the time? It's pretty good, right? You got 95% average on all your tests from here on out. It's pretty good, right? You'd be pretty happy with it, right? Okay, so that's 95% is all right. You could go for 99, but it's okay. 95 is pretty good, right? Let's stick with that. So again, basically all it's saying is how confident am I that the true population mean is going to fall within this value, this range of values I have here. Okay. So to interpret the confidence intervals, what do you need to do? Well, basically you have to go under certain assumptions, okay? Now again, what happens when you make assumptions? Yeah, you can make mistakes, right? So this is why you want to make sure that you're reading from reputable journals. You want to make sure that you're reading peer-reviewed journals, because sometimes researchers can violate these assumptions and thus make incorrect conclusions, which is no good. We'll talk about the different types of errors you can have from that. But again, our assumption here that it is a random sample that we pulled from. We're assuming that the sample that we pulled out of that population is a random, somewhat representative population of that group there, right? So that's something we're trying to assume there. Oftentimes it's not going to be true, but there's ways we can do that. So for instance, we can do things like certain tests that we can try to do for that. We can control for certain factors like gender, race, socioeconomic status. You can control for a lot of things. And then you also have to consider, was this a truly random sample or is it a convenient sample? You know, what's a convenient sample mean? Yeah, first people to come along, or say I put out an ad online that says, hey, you get $50 if you come and take this new medication. You know, these people, that's not truly random, right? You have people that are highly motivated by money at that point to come in and take that medication, right? So there are different things you have to consider there. Yes, sir.
Kind of like you can never be 100% certain in statistics. You can't be certain you have a truly random sample very easily, right?
Right, so there's ways we can try to account for that, right? So there's certain things, but even in the tests that we do to assume that it's completely random, we still only are about 95% sure, right?
Right.
And when you're 95% sure, that still means you're wrong how many times? 1 out of 20, right? So there's still room for error, right? So again, you do as many things as you can to try to ensure truly random sampling, but oftentimes it's not going to be the case there. There's a lot of computer software and things like that actually work to truly randomly sample things, but even then, even software is somewhat inherently biased based on the actual programming itself. It may not be 100% random, but most times it's good enough, right? So if I call on you guys in class and I go to the Google random number generator, it may not truly be random, but it's usually pretty close, right? Enough to at least terrorize one of you out of 63, right? Anywho, also you're going to see that we're assuming we have independent observation. So what does that mean, you think? Means we're not measuring the same person multiple times, right? Because again, that could skew it. If that one person was an outlier, there'll be multiple outliers, right? So every person gets measured once, and then that's it. Or it'd be also a problem if you had siblings that were being measured. How might that be an issue? That could be very similar, right? Genetically similar, so that way, and again, I kind of use it as an example. So if you have triplets, and I got all 3 of them enrolled in a study, you might perform very similar, and it could be an outlier. It could skew the data there. That would not be an independent sort of sampling. Now, there are ways you can do that. You can design a study to do things like paired samples, where you can actually do like pre and post. I can try different things like that. But again, these are things we'll get into a little bit later on in terms of study design. But generally, you want to have independent observations, each person individually by themselves. Now, could I do a husband and wife? Maybe, right? But however, they have similar environmental situations. Maybe that's something that could skew the data. Who knows? These are things you want to account for if you're a researcher or when you're reading the papers. We should assume it's accurate data. So we're going to be assuming that the confidence interval is based off of data that was measured correctly. It's measured the same way every time. And then we also are hopefully assessing an event that we actually care about, right? So again, if it's something like, toenail growth rate in adult patients, do I actually care about that? Probably not. But if I'm looking at like survival rates or rates of MI, things like that, it can make a big difference there, right? So you want to make sure it's something you actually care about. For instance here, in this case, if I'm checking temperatures, maybe I want to make sure I'm actually getting core body temperatures, not just a couple of random oral ones, because I know that's going to be a better idea of what the actual true temperature of those patients are, right? And then finally, we have this population is an actual Gaussian distribution. Now, the random sampling is going to be able to help with that to make sure we have a truly bell-shaped curve, but there's also other tests we can do for that. We'll talk about it later, but there's what we call tests for normality to show if it's a normal distribution or not. And I can tell you I've failed every test for normality I've ever taken, just very abnormal, as it turns out. Just kidding. Okay. Anywho, so again, what happens if the assumptions are violated? What do you think would happen to your confidence interval? It ends up being too generous, right? So you end up seeing that the confidence interval, you kind of get overconfident and you say, I'm really, really sure that it's this really narrow range of values. And that may not actually be true. You may actually make an error, and the true value actually falls outside of that. So typically, what you tend to find is that when all the assumptions are met, that will have a wider confidence interval than if you were to violate some of these. You tend to be overconfident, and then you may actually come up with a false positive error, things like that. So again, there are ways to get around this. We'll talk about those later, but this is kind of just the very basics of how you would run an experiment. Okay, let's do a couple questions. Do some answers, and then I'll let you guys go, right? I will not go all the way to 4:30 like I'd originally planned. Please make sure you do that survey quiz. I really appreciate that to get a better idea of what you guys actually want to do studies or read articles on. That'll make it more interesting for you, hopefully. Now, looking at this, okay, can the mean or the median equal 0? Can it be negative? What do you think? Depends on the type of interval, but yes, the mean or the median can have any value, including negative values or 0. It really depends on kind of what you're measuring there. Obviously, if you're doing like things like temperature in Celsius, you can have negative values there. That's totally appropriate. Okay, what do you think is larger, the mean or the median? So if you say it depends on every single one of these, you're probably gonna be right most of the time, but make sure you understand why you're saying that. It depends on the data for sure, right? So sometimes depending on the presence or absence of outliers, you may find that one tends to be larger than the other, one may be a little bit lower. It really can really depend on the data. Typically, when you find if you have data that is normally distributed, the median and the mean are actually pretty close to one another, as it turns out. It's kind of a good rule of thumb. If your median and mean are very similar, the data is more likely to be normally distributed. We use that sometimes when we're looking at things like patient turnaround time or time to provider and things like that in the ER, because again, there's a lot of metrics in the ER to make sure you have good patient flow through, and so we'll look at stuff like that occasionally. Okay, are mean and average synonyms? Yes, they are interchangeable, right? So mean, average, either one's totally fine. What units are the mean and median expressed in? It's another one. It's the same units as the data, though, right? So again, if it's something like the mean the data was in blood pressure, you'd be expressing the mean as millimeters of mercury, right? So again, if you're expressing it in terms of, say you're doing median and you're looking at a Likert scale, right? So strongly disagree all the way to strongly agree, it's going to be whatever that data is, right? So again, that's very dependent on the data itself. Can the mean and the median be computed when the n is 1? So I have one person, one individual I'm observing. No, not at that point. How about 2? Those you could do, right? Again, with 2, it's totally fine. You should get an average, either of those. Because again, when you only have 2 values, how do you get the median? You'd end up averaging anyway, so at that point, the average and the median would actually be the same. It wouldn't make a whole lot of sense. I don't know why you'd run a study with just 2 people, but you never know. Weirder things have happened. Is the 50th percentile the same as the median? That is true, right? So again, when you see medians being expressed, oftentimes you're going to have the interquartile ranges being expressed as well, so the 25th and the 75th percentile. But yeah, that's how you're going to be measuring those typically. Can the standard deviation ever equal 0? Yeah, so if every single value is the same, then there's no variability in the data. Your standard deviation would be 0, right? Because again, that's what we're measuring there when you get standard deviations, how far away from the average are those values. Could it be negative? No, not in that case there, right? So again, the standard deviation would be 0 if all the values are identical, Never will it be negative. Okay. What units do you express standard deviation? What do you think? Same units as the data, right? So again, it would be millimeters of mercury blood pressure, it would be pounds, kilograms, whatever you want it to be. Okay. Can the standard deviation be computed when the n is 1? No. How about when it's 2? Yeah, that you could do as well. Again, it wouldn't make a whole lot of sense, but you could do it, right? Is standard deviation the same as the standard error of the mean? No, those are very different. What does the standard error of the mean tell us? Closer our average is to the population average there, right? Because that's what's really important, is because it incorporates what value into it? The sample size, right? So the n gets incorporated into that, and that's how we get our confidence intervals. That's really important we get that. So very different between the two there. And then is Gaussian the same as a normal distribution? Yes, 100%. Those are very interchangeable terms. And are all bell-shaped distributions Gaussian? Right. So again, all Gaussian distributions are bell-shaped. Not all bell-shaped curves are Gaussian, as you'll see. Again, depends on the outliers that are present. Depends on a lot of factors there. But that's where we're going to do some of those tests for normality and things like that to see, is it truly a Gaussian distribution or not. We'll talk about that later. Okay. Why do we like 95% confidence interval? That's what we've done kind of forever. Like, it's one of those things. It's kind of arbitrary, but it's one of those things where it's just been done forever. So we're going to continue doing it forever until someone genius comes by and gives us a better idea what to do. Does the confidence interval of a mean quantify variability? Yes, think. Not really, right? So it's not really telling you the spread of the data specifically. It's trying to tell you, again, if you were to extrapolate this sample size back to the whole population, how confident are you? 95% confident that the actual population average is within a certain range, right? And so again, that's what it's trying to tell you. It doesn't really tell you a whole lot about the variability, even though standard deviation goes into calculating it, because it goes into calculating the standard error of the mean. So it kind of incorporates some of that stuff. Is the 95% confidence interval always symmetrical around the mean? What do you guys think? Depends on how it's computed. Typically, yes. Typically, it's pretty close to being evenly distributed around it. You don't typically see very wide ranges going one way or the other, but typically, yes. Would a 99% confidence interval be wider or more narrow than a 90%? Be wider, right? You need to give yourself more wiggle room to be that much more confident, right? So again, if you're trying to assess like how much a car costs just by looking at it, imagine going on The Price is Right or something, right? Where you want to get as close as possible without going over. Again, you want to give yourself some wiggle room if you're more confident. It's like, okay, well, what's somewhere between this and this? I'm not confident, you give yourself more room. That's right, so the 99% would be wider. What does standard deviation quantify? We already kind of talked about that. It's going to be variability around the mean, the scatter of the data, right? And then we talked about standard error of the mean. This is quantifying how close we think that value is going to be to the actual population average. So, are standard deviation and standard error of the mean expressed in the same units? Yes, they're going to be the same units as the data. Okay. Which is smaller, standard deviation or the standard error of the mean? Why is that? It's always divided by the square root of the n, so that'll always be smaller. So standard error of the mean is always going to be smaller there. And then if I increase sample size, standard deviation is expected to get larger, smaller, or stay about the same. If I have more people I'm looking at, this is a good it depends one. It kind of depends on the data. Typically, you'd expect that standard deviation does not change as predictably. Maybe you're including more outliers in that case there when you kind of increase your sample size. But as far as the standard error of the mean, what would that do? But n keeps getting bigger. Standard error of the mean will keep getting smaller in that case there because your denominator is bigger at that point. Okay, so you get smaller. Cool. So that was our first 2 lectures for Epi Bio. Hope your brains are not completely melted. That's okay if it is. Let me check to see if there's any questions on the board. I got 2 questions. All right. So number of kids someone has is not an interval variable. So number of kids. What do you think? Could I have negative kids? Sometimes I wish I had negative. I'm just kidding. I hope they never listen to these lectures. That'd be very sad. Not only this, I tend to overshare, and then actually my second daughter, Phoebe, she was here for Peds Day, so she was like being splayed open like by Dr. Nicholson in front of like the entire class. So hopefully she doesn't remember that. She's only like 3 months old, so probably not. But no, so that would actually be a ratio variable. So the number of children, because again, 1 child to 2 children would be the same as 0 children to 1 child. So yeah, I would consider that to be a ratio variable, if anything. What's the probability that planes end up flying on Sunday? I don't know. Is anyone flying out? Need to fly back in? I hope not. I pray the weather is in your favor. Yes. Anyway, if nothing else, I will see you guys next time.
I have a question.